Understanding seizures, a sudden disruption. Seizures are like electrical storms in the brain. They happen when brain cells, called neurons, send out sudden, uncontrolled electrical signals. These signals can cause a range of changes in behavior, movement, feelings, and consciousness. Imagine a well-coordinated orchestra suddenly playing out of tune and out of sync. That's what happens in the brain during a seizure. Seizures can affect anyone, regardless of age, gender, or ethnicity. They can be a one-time event, or they can happen repeatedly. When a person experiences recurrent seizures, they might be diagnosed with epilepsy, a neurological disorder that affects millions worldwide. Understanding the different types of seizures, their symptoms, and treatment options is crucial for both patients and their families. This knowledge empowers them to manage the condition effectively and improve their quality of life. In the following sections, we will delve deeper into the world of seizures, exploring their causes, diagnostic methods, and treatment approaches. Febrile seizures, as the name suggests, are seizures triggered by a high fever. They primarily affect infants and young children, typically between 6 months and 5 years of age. These seizures usually occur when a child's temperature rises rapidly, often due to a viral or bacterial infection. Febrile seizures can be alarming for parents and caregivers, but they are generally harmless and rarely cause long-term health problems. They usually last less than a few minutes and stop on their own. During a febrile seizure, a child may lose consciousness, experience muscle stiffening, twitching limbs, and rolling eyes. Most febrile seizures are simple febrile seizures, which are brief and unlikely to cause lasting effects. However, a small percentage of children experience complex febrile seizures, characterized by longer duration, focal features, or recurrence within 24 hours. While febrile seizures are usually benign, it's crucial to seek immediate medical attention whenever a child experiences one. This allows a healthcare professional to rule out other serious conditions that may mimic febrile seizures and provide appropriate care and reassurance to the parents or caregivers. In the next section, we will explore another common type of seizure: epileptic seizures. These seizures are not caused by fever, but rather by abnormal electrical activity in the brain. Unlike febrile seizures, epileptic seizures are not caused by a fever. They are the result of abnormal electrical activity in the brain. This abnormal activity can be due to various factors, including head injury, stroke, brain tumor, or genetic predisposition. Epileptic seizures can manifest in various ways, depending on the area of the brain affected and the extent of abnormal electrical activity. They are broadly classified into two main categories: focal seizures and generalized seizures. Focal seizures, also known as partial seizures, originate in a specific area of the brain. They can cause a wide range of symptoms, depending on the affected area, ranging from subtle changes in sensation or emotion to involuntary muscle jerking or repetitive movements. Generalized seizures, on the other hand, involve both sides of the brain from the onset. They often result in loss of consciousness and can manifest as absent seizures, brief episodes of staring, tonic-clonic seizures, formerly known as grand mal seizures, characterized by convulsions and loss of consciousness, or other types. Understanding the different types of seizures is crucial for diagnosis and treatment. Proper classification helps healthcare providers determine the underlying cause of the seizures and develop an individualized treatment plan tailored to the patient's specific needs. Section 4. Recognizing the signs. Symptoms of seizures. Seizures can manifest in a variety of ways, and recognizing the signs is crucial for seeking timely medical attention. While some seizures are dramatic and easily recognizable, others can be subtle and easily missed. Common symptoms of seizures include staring spells, which are brief episodes of staring blankly, often accompanied by a lack of awareness of surroundings. Uncontrollable muscle jerking, which are sudden involuntary contractions of muscles, ranging from mild twitching to violent convulsions. Loss of consciousness, which is a complete or partial loss of awareness and responsiveness. Changes in sensation, such as unusual smells, tastes, sounds, or visual disturbances, and cognitive or emotional changes like confusion, disorientation, fear, anxiety, or déjà vu. It's important to note that not everyone who experiences these symptoms is having a seizure. These symptoms can also be caused by other medical conditions. However, it's always best to err on the side of caution and seek medical attention if you or someone you know experiences any of these symptoms. If you witness someone having a seizure, it's essential to remain calm and take appropriate first aid measures, which we will discuss in the next section. Section 5. Diagnosis: Unveiling the mystery of seizures. Diagnosing seizures involves a comprehensive evaluation to determine the type of seizure, the underlying cause, and the best course of treatment. This process typically includes a detailed medical history, a physical exam, and various diagnostic tests. The medical history is crucial in understanding the patient's seizure experience. The doctor will inquire about the frequency, duration, and characteristics of the seizures, as well as any triggering factors or associated symptoms. The physical exam helps assess the patient's overall health and rule out other potential causes of their symptoms. It may include a neurological exam to evaluate motor skills, coordination, reflexes, and sensory perception. Diagnostic tests play a vital role in confirming the diagnosis and identifying the underlying cause of the seizures. These tests may include an electroencephalogram, or EEG, which is a non-invasive test that records the brain's electrical activity using electrodes placed on the scalp, magnetic resonance imaging, or MRI, which is a detailed imaging test that uses a strong magnetic field and radio waves to create images of the brain, and blood tests to rule out other conditions that can mimic seizures, such as electrolyte imbalances or infections. Once a diagnosis is made, the doctor can develop an individualized treatment plan tailored to the patient's specific needs.